Let's talk about the pharyngeal apparatus, which begins during the 4th week of gestation. This complex includes the pharyngeal arches, which are bars of mesenchymal tissue derived from both paraxial and lateral plate mesoderm, and crucially from neural crest cells. These cells migrate into the arches to form the skeletal and connective tissue components. The outer surface is lined by ectoderm, forming the pharyngeal clefts or grooves, while the inner surface is lined by endoderm, forming the pharyngeal pouches. There are typically 5 arches, with the 5th arch usually regressing. The first pharyngeal arch, also known as the mandibular arch, receives the trigeminal nerve, cranial nerve 5, specifically its mandibular division, the 3rd division. This nerve provides motor innervation to the muscles of mastication, including the temporalis, masseter, medial pterygoid, and lateral pterygoid muscles. Additionally, it innervates the mylohyoid, the anterior belly of the digastric muscle, the tensor tympani, and the tensor veli palatini. Sensory innervation from the first arch covers much of the face via the trigeminal branches. The skeletal derivatives from the first arch include Meckel's cartilage, which serves as a template for the mandible but largely regresses, leaving behind the malleus, the incus, and the sphenomandibular ligament. The maxilla, zygomatic bone, and temporal squamous part also form from this arch via intramembranous ossification. Defects in the migration of first arch neural crest cells lead to Treacher-Collins syndrome, characterized by mandibulofacial dysostosis, or to Robin sequence, which presents with micrognathia, glossoptosis, and often a cleft palate. The second pharyngeal arch, the hyoid arch, is associated with the facial nerve, cranial nerve 7. It provides motor innervation to the muscles of facial expression, the posterior belly of the digastric, the stylohyoid muscle, and the stapedius muscle in the middle ear. The skeletal elements arising from Reichert's cartilage of the second arch include the stapes, the styloid process, the stylohyoid ligament, and the lesser horn and upper part of the body of the hyoid bone. The third pharyngeal arch is associated with the glossopharyngeal nerve, cranial nerve 9. This nerve innervates only one muscle, the stylopharyngeus, which is involved in swallowing. The arch contributes to the skeletal structure via the greater horn and lower part of the body of the hyoid bone.